So I would like to call on Professor Jaiyesim. Please introduce yourself and give your presentation.
Good afternoon, good morning, good evening from wherever you're tuning in. First and foremost is to say thank you to all attendees for taking their time out on a Saturday afternoon to listen to us. I would also want to say thank you to Nigeria Magazine for this kind of invitation. My name is Rotimi Jaiyesim. I'm an associate medical director for patient safety at the University Hospital in Basildon, where I also practice as a consultant in obstetrics and gynecology. I'm also an NHS patient safety specialist and an adjunct professor of law at the University of Ibadan in Nigeria. Uh, there are other hats I wear which I'll leave for later. Um, Interestingly, I have got two devices. I may ask you to make me host on the second device. I think it's the second device. Um, Declaration of interest. I'm not speaking on behalf of my employers, that is the National Health Service in the United Kingdom. My views are personal. So what I say today are my personal views. I would want to say thank you to Professor Folani as well as Professor Ogbuagu for their very excellent presentation. It's made my job uh, slightly easy for me. There might be some repetition, but I think the more you hear from different people, perhaps the more you believe that, yes, there is evidence and there's some credence to what we are saying. The two first speakers approached it from a scientific point of view, the genomic sequencing of the virus, the clinical trials of the vaccine development, and what I'm going to do is to try and look at it from a practical layperson point of view. What concerns each individual? And that's the outline of my talk today. Like I said, a lot has been said about it, how it started in China in December 2019 and how it's become a pandemic. And as of 4 o'clock today, we've had over 135 million cases of COVID-19 globally. And we've had almost 3 million people die globally from this infection. And 419 million people have been vaccinated globally as we speak. At this point in time, on behalf of all of us, I'm sure we express our sympathy to those who have lost loved ones. And as Dr. Ogwabu said, there are people suffering from long COVID. Our empathy goes to them as well. Now, when the pandemic came, all we had at that time, we all were in panic, we were afraid, we didn't know what to do, we didn't know what treatment, we didn't even know what the virus was, we didn't know what the origin was. And what we initially had to put in place were what I describe as preventive measures. And again, we were forced to go into lockdown, where everything was brought to a standstill in different parts of the world. And that had an effect on the economy, it had an effect on the well being of many, many people. And these were one of the measures that came in place at the beginning, that we should wash your hands with soap and water for 20 seconds, or you could also use hand sanitizers in the absence of soap and water. We all like to shake hands and to hug each other. We were stopped from doing that. And to keep 2 meters apart from each other, or some people call it social distancing. Some people prefer to use the word physical distancing. We were also advised to stay at home if you were clinically vulnerable, that is, if you had underlying diseases such as cancer, sickle cell disease, hypertension, you were told to stay at home for your own safety. And we were all told to stay safe. At the beginning of the pandemic, we did not know the value of the mask, and that is why it's not listed as number 7. But as we went on, we found out that because it's an aerosol generating virus, that using the mask was also protective to the individual as well as to other people. And you could see me in my mask there. But the numbers kept rising, and we were all scared, afraid. And as of today, again, in the United Kingdom where I practice, we've had over 127,000 people dead. Luckily, 38 million people have been vaccinated. At the beginning of the pandemic, people were of the opinion that Africa was going to be devastated by this virus. And that's because of the poor healthcare system within the continent. But for reasons that we are not certain, if we take Nigeria, and every death, this is not said glibly, every death is regrettable. Every death is somebody in a family. In Nigeria, we've had 2,059 people die. Part of the reason why the numbers in Nigeria may be this low could be due to the young demography. over 50% of Nigerians are under the age of 20. And we do know the young people get the infection, but they don't get the severe form of the disease. And perhaps for that reason, that's why our numbers are low. We also know that definitely we were undercounting, underreporting, but again, that will not have brought our figures to what the suggestions were at the beginning of the pandemic. So it was a new disease. We were uncertain of the best treatment. There was no cure for it. And we were all clamoring for a vaccine. Oh, how would we get this vaccine? People were praying that we get a vaccine. We've been told what vaccines do. Effectively, what they do, when you get a vaccine or when you get vaccinated, your body recognizes that particular form of virus and develops antibodies against that virus, such that should you come in contact with a real virus, then you already recognize it. You have the ability to recognize it and to defend yourself so that you don't get severe illnesses. Now, this is a diagram that shows you how long it can take to develop vaccines. Malaria vaccine, I think, will come into practice maybe in the next 2 to 3 years. Research has been going on, but look how long it's been going on for, and yet we haven't got there. Polio, we've succeeded in eradicating. You can see the lines, how long they are, but when you look at COVID-19, in less than 1 year, we were able to find a vaccine. And some of the reasons has been alluded to in previous talks. Yeah, so we were all happy that the vaccine was here at long last. There are different types, and what we tell people, I do get people asking me which one is the best, which one should I take? And as Professor Obuago has told you, the effectiveness, 95, 96, even 56%, they are all effective. Your body will mount an immune response if you receive any of this. So I wouldn't go into depth because you've heard about this already. And that's about talking about the effectiveness of the vaccine. Now, when the vaccine came, the very first person in the world to receive the vaccine was in the United Kingdom, a 91-year-old woman. She got it on the 8th of December, what a Christmas present. And again, as a birthday present, by the next birthday, she had received her second dose. And she tolerated it very well. That's a 91-year-old lady. But in spite of the fact that, yes, human beings were able to crack this quest for a vaccine, there were concerns about the vaccines. And I always say, look, there's no doubt that these concerns are genuine. And if you look into the literature or even into the media, people use the word or the phrase vaccine hesitancy. It has come to stay, but I would rather say people have concerns about the vaccines. And it is for each and every one of us to be open and to try and address these concerns. Now, concerns are beliefs that people hold, they believe in it, and if you believe in something that's against your belief, then you do have genuine concerns. But they need to be explored, really. What are your concerns? And that is why the Q&A session should be the most interesting part of uh, this evening, because it gives us that opportunity to address your concerns. Then myths in their own try to make sense of things happening in the natural world around us. Now, the problem about concerns, misinformation, disinformation is that when there's no basis for it, they can be life threatening. And we've got to be careful. And when I say why the hue and cry about the vaccine, it's because, for example, there are historical reasons. People may be aware of the leprosy trial that went over for 40 years, where this was a trial for leprosy. And the black people in the trial were told they were being treated, but apparently they were not being treated. And it came to light. It involved the United States Public Health Service, and it even went into the Center for Disease Control area. Then, coming close to Nigeria, we know in Kano in 1996, Pfizer undertook a trial in which 11 children, I think, died. There were issues with that trial. When I said 11 died, 5 died in the trial arm, and I think 6 in another arm, which was the placebo arm or so. But if you look at that trial, I'm not saying what Pfizer did was right. 15,000 people died in that trial during that period. And these are the things that have bred or are breeding mistrust between citizens and governments and between citizens and the pharma industry. Then we also have the faith-based aspect, where people believe through their religion that you shouldn't have the vaccines. Now, just going to what people's concerns are, people say the virus does not exist, that one, it's a way to try and siphon money politically, that it's all lies. We all know, I mean, with over 2 million people dying, that the virus does exist. It's real. I'm a survivor of the COVID. I got it, so I can talk that it is real. In Nigeria, there is a state called Abia State. The governor said because Abia was in the Bible, the virus will never come into the state. We know that's not true. It is said the COVID-19 is just like a flu. No, it's not just like a flu. The mortality rate of COVID is 4 to 5 times higher than that of the seasonal flu. And again, people have spoken about 5G network, that they want to use it to kill us or to monitor us. I mean, we all have telephones that we carry around that have, even your car has a GPS tracker. Your phone knows where you're going, where you've been, and all that kind of stuff. So it's not due to 5G has nothing. It's not going to damage our health or anything like that. Then there's the concern about the use of aborted fetuses in the vaccine. My understanding is that decades ago, fetuses were used in the development of vaccines. And what they did was to develop cell lines. And it is those cell lines that scientists still use. And when I read back, these are not fetuses that were aborted as a result of, oh, I don't want this pregnancy, can I get rid of them? There may have been miscarriages that they had harvested cells from. So when people say, oh, they've used aborted fetuses in this current vaccines, the answer is no, aborted fetuses were not utilized. The rapidity at which the vaccine was developed has been addressed by Professor Obuagu. But one of the things I would say when people talk about mRNA technology is that the technology, they say it's going to change your DNA, and Professor Obuagu has told you, no, it's not going to change your DNA. Your DNA is in the nucleus. The vaccine is given um, into the cytoplasm where after it's done its job, it disintegrates. Now, for when I talk to, because I've spoken at churches, at different fora, I tend to use the avocado as an example of a cell. The hard nut that is in the middle of the avocado, or at times in Nigeria we call it pear, is where the DNA resides. And the green fleshy bit that we eat is the cytoplasm, and that's where the vaccine is put. And it does not go into that hard nut. So it does not alter the DNA of human beings. Now, this is a magazine, a scientific article going back to 2013 or 2015, showing you or showing us that the mRNA technology had been used to treat high cholesterol levels in human beings. I am also aware that the mRNA technology has been used to treat psoriasis, which is a fairly common skin disorder. So the mRNA technology is nothing new that humanity has developed to change our DNA. It's been in existence. And that's the one, 2018, for the treatment of psoriasis. Now, Professor Buagu has spoken about this. But one of the things that people tend to do is to play to your fear. Now, if as a couple you're told, oh, the vaccine will cause infertility, you wouldn't want to take it. Oh, if you're a man and they say, oh, you're not going to be able to perform because it causes erectile dysfunction, you wouldn't want to take the vaccine. So these concerns are some of the things that people have said. I mean, in fact, the vaccine is barely 1 year old. So how can anybody say that it causes infertility when you will not describe a couple as being subfertile until after 12 months of trying for a baby? Again, it does not stop female periods. It can be used in pregnancy. And when I say it can be used in pregnancy, more so those with underlying conditions. And as we've heard from Professor Boagu, even during the trial, some people were found to be pregnant, and no untoward effects has been shown, and trials are now being conducted in pregnant women. And breastfeeding mothers, if they want the vaccine, with discussions with a GP or family doctor, can have it as well. What you see here, garlic, lettuce, ginger, onion, all of these are nutritional supplements or elements. We as human beings, I mean, the disease we get, whether it's high blood pressure, maybe because we're overweight, obesity, we eat too much. What I tell people is these measures do not prevent or reduce or cure COVID-19. we are expected to eat a healthy diet. And if you are eating a healthy diet, most likely it will contain some, if not all of this, including the vitamin D and the vitamin C. This should be what we eat normally on a daily basis. Oranges, not when COVID or there's a pandemic. Again, there's no scientific evidence for hydroxychloroquine, chloroquine, steam inhalation, using alcohol or Dettol to have a bath. Then at the beginning of, we heard a lot about Madagascar cure. Nigeria received a few samples of Madagascar cure, but nobody talks about it anymore. And I'm sure that's because there hasn't been any scientific evidence to show that it is effective in treating or in preventing or treating Madagascar cure. To this list, I can add ivermectin. The scientific world has come out because science is what should lead us. They have looked at it and have come out, different bodies have come out to say there's no evidence that it's effective in preventing or even treating. But you will always get a body of evidence that will say, oh, yes, it's the best drugs in sliced bread. One, I'm not recommending it. That's a right I'm going to get. But what I tell some people at times is if a drug will not cause you any harm and you have no other alternative other than ivermectin, and I know that's the picture in Nigeria until the vaccine started arriving, that, well, you might try it. One, the side effects are minimal. It might work. It might be a placebo effect. But for as long as that is not going to damage your health, please, you decide what you want to do. I will skip that slide. One other thing I would like to advise people. People were scared about the virus. Stigmatization happened in Nigeria. There's no stigma associated with COVID. Like I said, I've had it. And I mean, I say it, it's not anything that is transmitted for things I've done wrong. Anybody can get it, and we know the UK Prime Minister got it, Prince Charles got it, different people got it. Uh, so if you are ill, if you have underlying medical conditions, for example, if you have an acute chest pain, please don't stay away from the hospital because what's going on with you could be life-threatening. Now, I'm just going to address faith and COVID-19. I think more so the Christian faith. And I know Nigerians pray a lot, and we are all uh, people of faith, whether Muslims or Christians. But one of the things people say in trying to dissuade others from receiving the vaccine is that it's the mark of the beast. It's the end times. That if you take it, that's you're taking the 666 or the mark of the beast. But when I looked into, I mean, this is what people, this is the verse people quote that, and he causeth all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads. The vaccine is not given in the forehead. Now, okay, the right hand. Well, you could then elect to have the vaccine in your left hand. You've got two hands. And I mean, then, but this is what people quote. But I read Revelations. I'm not a person, I'm not a theologian. So, but like I said, I'm a Christian. But it says, verse 1 says, I stood upon the sand of the sea and saw a beast rise out of the sea, having 7 heads and 10 horns, and upon his 10 horns 10 crowns. I haven't seen that, and I don't think anybody's seen it. I take it literally, just as we interpret this literally. I'm also interpreting verse 1 literally to say the vaccine is not the mark of the beast. If we were going to have the mark of the beast, we already have it. Like I said, our GPS, you don't even need security guards now. You have number car plate readers that will open the bar for you. In Nigeria now, we have BVN, NIN. In the UK, the National Health Insurance Number. Everybody in the UK has a national health number that you're given at birth. And when you use your store cards, they have all your details. When you visit a site on the internet, when you browse looking for an object, before you know what, they're advertising what you have gone searching for. So we don't need a vaccine as a mark of the beast. Big Brother is already watching us for whatever reason, and there's nothing wrong with that if you have no skeletons in your cupboard. That's what I say. Community leaders, faith leaders are important in addressing this issue or concerns about the vaccine. These are very, very influential people. You've got Apostle Suleiman, who said he had bought his third private jet during the COVID era and that he wanted COVID to continue. I mean, I don't like using the word man of God. He's a pastor. Uh, Pastor Yakilome also said it recently. His church in the United Kingdom was fined about £125,000 for asking the congregation not to receive the vaccine. Um, Pastor in Cameroon said there was no COVID, but he died of COVID. The Tanzanian president, the official version is that he died of a heart problem, but the story going around is that he died of COVID. I'm not too sure what the correct version is, but these are people who are key opinion leaders in society, trying to dissuade people. And more recently was Pastor Okotie, Chris Okotie, who said, if you receive the vaccine, you will become a vampire. I mean, should not be really tolerated. What I would like to see really is what we call vicarious liability. If a pastor or anybody can say, don't take the vaccine, and should anything happen to your family, I will take care of them, then fair enough. But I'm sure most of them will not want to go down the line of vicarious liability. This is what it says. In all things, get wisdom. God gave us wisdom to be able to develop these vaccines. Faith. Our faith without works is dead. Have a discerning spirit. Look at the deadly effects of the virus and then the vaccine. No false doctrines. Jesus was a healer. Even his apostles, there were doctors in his 12 apostles, among his 12 apostles. So when faith people come saying it's the mark of the beast or it's against their religion, I think we've got to be very careful. The vaccination gives us the best opportunity against this virus. It will protect you, it will protect your family, and it will protect those people who you come in contact with. Unlike the mark of the beast, the virus is not written on the forehead. You will not know who has it. And that is why we're all now wearing masks and still trying to keep our social distance. Now, I'll be rounding up in a few minutes. This is something that people are worried about. Are we going to require COVID vaccine passports? I mean, there's nothing wrong with having COVID vaccine passports. That is an international certificate of vaccination. This is my own. I had this in 1975, and I think the last time I had an entry in it was in 1981. This is my UCH vaccination card. I couldn't practice, even as a medical student, you wouldn't be allowed to practice. In one of my hospitals, as a doctor, I have to be vaccinated against hepatitis B. And this yellow card, which we still carry, it says International Certificate of Vaccination or Revaccination against smallpox. We have it against smallpox. We've got it against uh, yellow fever and other viruses. It exists. So there's nothing new about certification of passports. I got my first job in December, that's me, and I got my second job February of this year. Quite, I was a little bit disappointed because I thought I would grow taller, but my height hasn't changed. Perhaps my hair has gone a little bit gray. I don't know. But jokes apart, I didn't have any problems with it. And at the end of it, this is my immunization history that even goes back as far as my childhood, my BCG for against tuberculosis. And after I got my second jab of the COVID, I was given by the hospital a certificate of vaccination. So there's nothing new about COVID uh, vaccines or passports, whatever you want to call it. Dr. Oguagu has spoken about the AstraZeneca and blood clots. It is very, very rare. Like we've said, AstraZeneca, about 20 million people have received it. 20 million. And we're talking of, yes, albeit very sad, 19 people have died. And drugs, there's no drug in the market including water, that doesn't kill. There's no drug in the market that doesn't have side effects or even severe adverse events. So, I mean, Dr. Buagu has addressed that, and this is very rare. I mean, with what we've seen so far, it's even less than 1 in 10,000 if we were to take 79, 19 deaths out of 20 million, uh, cannot be estimated from the available data. Yes, they've said there's some link to the vaccine, but we're collecting more data, and I'm sure as the days and months go by, we'll know what is going on. I did a 30-day survey of Africans in the UK. About 53 people, 53% said they'll have it. This may have changed now. Uh, the vaccine is available, and we need more campaigns such as what we're doing this evening. Not to force people to take the vaccine, but to equip them with the understanding of how it all began, what is available, and then for them to make their own mind up. Misinformation, wrong information can kill. And the thing is that one is likely to die from this virus than from the vaccine. Yeah, like we said, our empathy goes to them. It's been a long journey. We've got there, we've got the vaccine. Uh, let's continue to undertake the non-pharmaceutical measures. Very, very important. They do protect us. Uh, it's up to us if we want to avail ourselves of the vaccine. It's a personal choice, and you've listened to us, and we will welcome your questions.